So since we are looking at a lot of young people getting addicted to tobacco, both in the smoking form as well as in smokeless form. In fact, smokeless tobacco is a more important factor for oral cancer.
So, Doctor, you just mentioned a lot of the sections right now inside the mouth and the nasal area, including tonsils. So, are these all different cancers or?
And in younger patients nowadays, we are also looking at a virus called human papilloma virus. In the treatment, we are now getting into the minimal access or transoral robotic surgery,
Okay.
the TORS, to decrease, especially in the recurrent disease.
So, the mindset that it may cost a lot, or the mindset that, oh, let it be, the ignorance and the
Fear.
cost fear should be avoided.
And also an exposure to alcohol from an early days. So most probably they both causing damage to the mucosa and causing cancer early.
Hello and welcome back to Expert Touch, a place where we talk about complex medical topics in a simplified version so that you can understand it better. And today we are diving into an important topic, which is head and neck cancer. This is a topic which is often ignored or overlooked because of many reasons. But today we have an expert who will let us know more and more about this topic. Do you realize that this is one problem because of which you can have problem in breathing, problem in speech or swallowing as well? So let me introduce you to Dr. Dipanjan Panda, who is Senior Medical Oncologist of Delhi and Noida Apollo. Welcome here, sir.
Thank you, Shoma. Thank you for having me here. As you have rightly pointed out, head and neck cancer is often less talked about, which is really unfortunate because, as you know, it is one of the most common cancer in India. Not only that, it is one of the preventable cancers. So we need to talk so that people are aware of how this cancer happens, how to prevent it, and how to get an early diagnosis.
Okay, so I have one question, Dr. Panda. You just said that this cancer is often not talked about much, but it prevails a lot. Maybe it doesn't prevail that much because of which people don't talk about it. No, it prevails a lot in India.
It is one of the commonest cancer in India. If you take the whole head neck cancers, which includes the oral cancer, oropharyngeal cancers, laryngeal cancers, so it is one of the commonest cancer.
One of the most common cancers in our country and in the world. And I think now it's time to simplify it to our viewers. What all types of cancers are there in head and neck category when we talk about?
So as the name suggests, head neck cancer is the cancers which happens in the head and neck region. It starts from the cancers of oral cavity, starting from lip, the oral cavity, the buccal mucosa that is inside part of the oral cavity. The cancers.
We're talking about the mouth.
Mouth, yes, of course.
Okay.
We doctors have a tendency to use medical jargons, so thank you. So it's a mouth cavity, inside the tonsil, then the posterior part of the mouth, which is oropharynx, and down to larynx, which is our voice box. Also in the nasal cavity, there are some air cavities in the near about nose called sinuses, and the salivary gland which secretes saliva. Some of them are more common, some of them are less common.
So, Doctor, you just mentioned a lot of the sections right now inside the mouth and the nasal area, including tonsils. So, are these all different cancers or are these combined into
most
one?
of them are histopathologically, by under microscope, they are squamous cell cancer, which means they develop from the epithelium of the surface epithelium. But of course, there are few cancers like nasopharyngeal cancers, which can have a different morphology. But when we talk about head neck cancer, mostly they are of squamous cell carcinoma, of which the commonest one is the oral and oropharyngeal cancers, followed by laryngeal cancers. The nasal, nasopharyngeal and salivary gland cancers are less common.
Okay, and I do consider it as a part of, we all consider it as a part of head neck cancer. Does head category also involves brain
No,
includes
head neck
brain?
cancer does not include brain malignancies.
Okay.
There are separate
Okay.
group of malignancies.
Okay, okay. Also, we would like to know which one is the most common prevailing cancer out of.
Well, if you ask me, the commonest cancer in head neck region is oral malignancy. And this malignancy is the most important because this is a malignancy where smoking and alcohol plays a lot of role. And in younger patient nowadays, we are also looking at a virus called human papilloma virus. We would like to know about this virus because this virus, which causes malignancy, are relatively more sensitive to treatment, and they happen in the little younger population.
Okay. Now we'll go a little bit into the past history. In olden times, cancer was considered one of the illnesses which either used to come or prevail when once you cross your 35 or 40, if I'm not wrong. Or you can rectify me if I'm wrong. And now it has been seen that it is happening in younger lot as well. So does head neck cancer also fall into that category?
Well, yes. So you are right, Soumya. One of the commonest cause of cancer or etiology of cancer is age. As we grow old, the incidence of cancer rises. They say if you are live till your 8th or 9th decade, maybe 1 in 4 or 6% will have some sort of cancer. However, we are seeing a lot of young people with having cancers. As such, in India, the incidence of many of the malignancies is a decade earlier than what we see in Western Hemisphere. But even that is becoming, the diagnosis becoming in younger people more and more day by day. There can be various factors. I think the food, environment, addictions, and sometimes part of gene also plays on that. As I said, oral cavity cancers, most important agent which is a preventable factor is tobacco and alcohol. So since we are looking at a lot of young people getting addicted to tobacco, both in the smoking form as well as in smokeless form. In fact, smokeless tobacco is a more important factor for oral cancer, and also an exposure to alcohol from an early days.
Yes.
So most probably they both causing damage to the mucosa and causing cancer early.
Yes, I totally agree with your point. एक और क्वेश्चन है मेरा, आप इतने साल से यू आर इनटू दिस फील्ड, तो मैं जानना चाहती हूँ कि जितने भी हमारे कैंसर ट्रीट करने वाले डॉक्टर्स हैं, सिंस व्हेन यू स्टार्टेड नोटिसिंग दैट ओके द यंगर लॉट cancer cases are increasing, when was the time when all the medical sector cancer treating doctors started realizing that the younger lot cases are now starting to rapidly increase?
Difficult for me to exactly pinpoint, but in the last 2 decades or more when I'm into it, in my first few years we generally used to see there are a certain group of cancer which happens in children. So I'm setting them aside. So as far as head neck cancer is concerned, I think there is a gradual shifting, and it has increased more in the last decades or so. It does not mean that this head neck cancer does not happen in older patient, but if you are looking at the percentage of patient, now there is a slight rise in younger patient a lot. You must also understand that cancer does not happen in one day. So as you take tobacco for that matter, now tobacco contains nicotine, which is an addictive substance which absorb in the blood and give you kick. But tobacco also contains various carcinogenic substances. So when you chew tobacco in the form of khaini or gutka, so you must understand, Soma, how people take this. So they mix tobacco with slaked lime, that is chun, and sometimes they also take supari, which is called basically nuts called Erica catechu. Now, this betel nut has got an alkaloid, which is a substance called ericoline.
Okay.
Ericoline and slaked lime, which is calcium hydroxide, causes irritation of the oral cavity mucosa. So when it irritates, it inflames, and the vessels, blood vessels, the blood tubes, they become dilated. So that's nicotine, which is there, they get absorbed directly into the blood, giving you a great kick. So people make a pellet, a small pellet of gutka, khaini,
Yes.
which is tobacco with chuna, and they put it into their gingivobuccal sulcus, which is the place between your lip and your gum, and from there the nicotine gets absorbed along with other carcinogenic substance. When you take it for a long times, they damage your oral mucosa, causing them initially to become fibrosed, so that you start having problem in opening mouth. It is causing oral submucous fibrosis. It also leads to white patches called leukoplakia and red patches. So from there, it's become precancerous and ultimately become cancers. So when your whole mucosa become damaged, when you have cancer in one part, you treat, sometimes you, after 5-10 years down the line, you find cancer in another site. This is called, there is it's a whole, that area becomes precancerous.
Okay. And not just tobacco, the ingredients added along with tobacco act as a catalyst and इससे काफ़ी ज़्यादा एग्रेवेट होता है. और अगर हम टोबैको की बात कर ही रहे हैं, सो आई थिंक दो और जो कंपोनेंट्स हैं उनकी भी बात कर लेते हैं. सिगरेट्स.
सो सिगरेट जब हम पीते हैं, सो सिगरेट में क्या होता है, देयर इज निकोटिन एंड देयर इज सो उसमें जो धुआं बनता है, दे हैव अ स्मॉलर पार्टिकल्स, सो दे गो डीप इनसाइड द लंग, they damage the mucosa lining of the bronchus and the bronchioles, which is the tubes leading into the lung, and the alveolus in the lung. So lung is like a sponge. That smoke goes and it damages the spongy structure of the lung, leading to carcinogenic change, which can lead to lung cancer. Not only that, it also damages the lung, causing many other factors called chronic obstructive pulmonary disease and other breathing problem. So smoking does not only causes cancer, it can also cause severe lung function defect. Ultimately, you cannot walk, you cannot talk, you become bedridden, you need oxygen all the time. It's a very difficult way to survive.
Painful. Difficult and
painful way to live and die.
Yes, breathing is the most important part of human functioning. Or and then last but not the least, alcohol.
Alcohol also causes damage to the mucosa. So smoking and alcohol, or tobacco, chewing and alcohol, are often people who also chew tobacco or smoke takes alcohol, so to get extra kick. But you must understand that the tobacco is already damaging your mucosa. Alcohol also damages your mucosa, and they together are supplementary to each other. So 1 + 1 2 नहीं 11 बन जाता है.
11 बन जाता है.
So there is definitely, we now know that smoking and alcohol together increases the risk of oral cancer and food pipe cancer.
Okay. My next question to you is, keeping these nicotine-oriented drugs aside, now coming to the environmental factors. In today's time, अगर कुछ decades पुरानी बात की जाए, the atmosphere, the oxygen levels, the greenery, everything was very different compared to today's toxic air that we are breathing. So we have a lot of people who are not consuming tobacco, cigarettes or alcohol, but cancer is something which also comes genetic at times, or maybe due to the atmosphere we live in.
That's a very important question, Soumya. So we must understand that there is a subtle difference between what is genetic and what is hereditary.
Okay.
So for that matter, all cancers are genetic, because you need some changes in your body's gene for that cell to multiply exponentially.
Okay.
But what is hereditary? Hereditary is that if there is a cancer causing gene there in your parents, and you are getting that inheriting that from your parents, from the germline.
Okay.
So there are only 5 to 10% cancer which is actually hereditary.
Okay.
Now coming to the environmental pollution, which is a very, very serious issue, you know, becoming a little philosophically, I think we are the only species in earth who are self-strangulating, अपना गला खुद घोट रहे हैं. हमें क्या चाहिए? I think we are seriously not understanding. हम बड़ा गाड़ी चढ़ते हैं, बड़े घर में रहते हैं, लेकिन पानी हमारी गंदा है, हवा हमारी गंदी है, and we are constantly, and it is very democratic. Even the top guy and the bottom people are, I think, having the same air to breathe. So constant exposure to environmental pollution is definitely one of the instigating factor in causing cancer. In air, there are many carcinogenic gas like sulfur dioxide, heavy metal particles, nitrogen dioxide, carbon monoxides, which when you day in and day out you take, especially the vehicular pollution, it damages your lung. And that, even if you don't smoke, you are unfortunately inhaling, you and me both.
Yes.
So I think we need to question ourselves. What are we doing it for ourselves and our kids? What is the purpose of surviving and doing? Are we doing enough for our next generation? Are we leaving them in a better world?
Yes, totally. And we are also, I would like to add to your line, we are also one of the species who are not just strangulating ourselves, we are also strangulating the rest of the species.
Yes,
of Earth.
absolutely.
So it's very tragic and sad in that
we
sense.
are greedy. We are greedy.
I think if I'm not wrong, the same disease prevails in animals and other species as well.
Well, we do see cancers in animals also. Yes, you're right.
That's very tragic and sad. Now, since we talked about environment and atmosphere, which is also very triggering, I would also like to ask you that there are many people who cannot escape the atmosphere. For example, outside the air is unhealthy. We can come and sit in air conditions, but a lot of the citizens in India, some of their professions are such that they have to face pollutions or chemical. Mostly people working in factories or maybe cosmetic industry or leather industry.
Yes, there are many others, like miners. Miners we do see.
Yes.
Especially a few of the substances known to cause, like if you are exposing to asbestos, which is a known causative agent of lung cancers.
Where is asbestos found the most?
So asbestos they are found in mines, but the use of asbestos was initially as a fire resistance clothes. So asbestos used to be used as a fire resistant substance. But when its carcinogenic effect was known, since then its use has been getting decreased, but it's not completely out. Plus there are also some solvents, some chemical factories, which ultimately leads to this exposure to some heavy metals like zinc, nickel, cadmium. They can also cause cancers. So yes, workers in various industries are constantly getting exposed to hazardous air as well as this substance. So there are guidelines for them, how to use, how much to use. Unfortunately, not all of them are implemented for various reasons because that cost money. And also there is a serious lack of awareness. So you must understand, as a society, you only get what you want. If you want a better walkway, footpaths, better public service, then you get that. If you don't want that, then you don't get. So I think when as a society we will ask for these things, if you ask me personally, I would like to walk or cycle from my house to my hospital, which is about 5 kilometers. Unfortunately.
But at what cost?
Unfortunately, even if you cannot walk, there is no straight walk away about 1 kilometer from my house to the hospital. So I think as a society, we should ask what is really, really important. We should introspect and ask ourselves, ask our family, ask our neighbor, ask each other what is really, really important to us.
Okay. Since you also mentioned a very good point that there are some rules and regulations and a disclaimer how to use chemicals in certain factories and industries. But for example, if you talk about people working in vehicle sector, repair work कर रहे हैं, या फिर electronic sectors, there are many people who are many mechanics who are repairing the electronics. अगर हमें इस पॉडकास्ट के थ्रू उन्हें बताना हो कि किन किन चीज़ों से, किन किन केमिकल से रिस्ट्रेन करना चाहिए और कौन सी हैबिट्स एक नॉर्मल पर्सन फिर भी एंटरटेन कर सकता है, बट सिंस दे आर वेरी एक्सपोज टू दीज केमिकल्स, they should avoid to have
No,
those habits.
you must understand that we cannot always avoid things. So it is better that we use proper protective gears while we are handling hazardous chemical. There are physical barriers, gloves, mask, and we must constantly look for people who works in hazardous industry where there is an exposure, and they should have an annual health checkup.
Health checkups.
But people, my point is that there are things which you cannot always avoid.
Yes.
But then there are things you can avoid, like smoking you can avoid, taking excessive alcohol you can avoid, chewing tobacco you can avoid. So things which cannot immediately be avoided, we can try to prevent the exposure. But there are things which are in our hand that we can do it from tomorrow.
Which is checkups.
Which is avoiding strictly no to smoking or tobacco in any form. And the government regulation should be strict enough and people should understand. So it has been seen that if you don't start consuming tobacco in your early 20s, you generally don't get hooked up.
Okay.
So government should be really focusing on the teenage boys and girls, because most of the time you start smoking to impress people.
Yes.
And then you just get hooked up. So there is nothing really, smart about smoking or chewing tobacco. Nothing. It's bad for you, bad for others. So as long as you understand that, then if you don't, government should come also heavy strict, become having the smoking outlets or the cigarette shops around the schools and colleges, around offices. Because if you don't have the access, then you don't generally smoke. But and government also has to understand that maybe they are getting a lot of revenue from alcohol and tobacco, but I think the health cost surpasses that. So again, we have to understand that how we really can stop, and not just to make a show of it.
Definitely. I think now we are covering the subcategory here, which is not directly connected, but it is one of the causes. So I would like to talk about this, that when we ask and when we question government, yes, a disclaimer is always explicitly mentioned, be it on screen, be it on the cigarette packets, but yes, most importantly, the cigarette shops, which are almost everywhere in 10 steps. If we do not take care of the regulation there, that what age is coming and buying the cigarettes and tobacco,
I mean,
then I think
government has regulation that you cannot have a cigarette shop near, I think, within 100 meters, 200 meters. But I think that rules are not always strictly followed. There are always placards that cigarette should not be sold to, or tobacco products should not be sold to people who are under 18. But then the implementation of the rule
is important and should be stricter. And if that is not happening, then I'm sure our audience can always suggest their friends and families to take care of that. And prevention in 20s, I think, is one of the very crucial things which should be taken care of.
Early.
And of course, teenagers definitely.
If you nip it in the bud, then things doesn't happen. If you don't smoke by mid 20s and 30s, then it is very rare for you to start. That's what people have seen.
Also, you mentioned tonsils, which is always which has been, by normal people, by a layman, we think that okay, that is something which never disturbs us, and क्या हो सकता है, कुछ नहीं हो सकता है उसमें ज़्यादा. So can we talk more about?
So carcinoma tonsil is a part of the carcinoma of oral cavity and buccal mucosa, but this is one cancer where human papilloma virus or HPV, especially the type 16, plays a role. So it is seen that HPV related cancers happens a little early, and they are more sensitive to the treatment, and they have a better prognosis, in fact. So when we check all oral cancer patient specimen, we all look for HPV infection that can be seen under microscope.
Okay.
So yes, HPV infection check has become one of the part of treating head neck cancer. And you must understand about treatment of head neck cancer, Soumya. Prevention is always better than cure. And diagnosing early is always better, because head neck area is a small area with very, very complex anatomy. So once you treat them, there are always some side effects left. So it is, yes, diagnosed early, we can cure it.
Yes.
And diagnosed late, the cure becomes difficult, and the side effects and the long-term side effects also become more.
Okay. You mentioned it in the beginning as well, that this is one of the head and neck is one of the cases where it can be completely prevented. If it's
not
diagnosed
completely prevented, but yes,
but
most of it can be prevented.
Yes.
As I said, smoking, alcohol, these are the two eminently preventable components.
Yes.
And even tobacco chewing, betel nut chewing, gutka, khanis, they can be prevented.
So these are the warning signs which we have covered and we have talked about.
So about the warning signs, there are few warning signs which I would like to mention. If you have a oral ulcer which is not going away,
okay,
if you have a red patch or white patch in your tongue or mucosa, if you are feeling inside your oral mucosa, normally it is wet and slippery, but if it is becoming dry, if you have a change in voice or persistent hoarseness which is not getting better, or you have any lump in your throat or in your neck, under the jaw, which is also not getting okay, then you must show to a doctor. Because as I said, most of the time it may not be malignancy, but if it is a cancer detected early, it is completely curable. Of course, that cure requires various type of treatment, which you would like to tell.
Yes,
So,
we'll move towards that as well.
Yeah.
But before that, I would like to know what is the percentage, or if you do not have to mention it in percentage, early diagnosis, it's not common?
Well, we do see many people with early cases, but the number are relatively less because of the less awareness. Sometimes people are afraid also, and we have a tendency to ignore also.
Yes.
So, first of all, ignorance. Second of it is that we are a little afraid to go to a doctor and think of what may happen. Also the cost, but many people don't understand that there can be simple remedies which is available in government hospital. So you don't have to come to always. So the government hospital has a good setup in most of the cases in many places to treat these conditions and detect it early. So need to go to a doctor is important.
Yes.
And whatever is near to you. If the nearest primary health center, you can go and talk. If it doesn't improve, then you can always go to the district hospital or to a referral hospital.
So the mindset that it may cost a lot, or the mindset that, let it be, the ignorance and the
Fear.
cost fear should be avoided. Regular checkups are important, and most importantly, when the patients are doing regular checkups, of course, early detection can be done and it can be taken care
of. In fact, detected early, the cost of treatment is not much. In government hospital, it is free, and most of the drugs are actually cheap and accessible. It is only when you come with an advanced disease, the cost of treatment increases and the results are also not great.
Definitely. Okay. Now we are talking about you have early signs and you have told them the warning signs as well. What are the different types of diagnosis? How?
Yeah, so you mean to say how to diagnose them?
Yes.
So
is it only doctor's job, or if it has become very late?
No, so depends on, we with an oncologist, we get referral from various people. We do get reference from dental surgeon. So people can go to a dental checkup for an ulcers, which is non-healing ulcers. We do get referral from head neck ENT specialist.
Okay.
We sometimes do get referral from physicians, primary care physicians, as well as primary care surgeons. So we are the second rung of people. We generally get referral. So you don't, with a lump, you don't always have to rush to an oncologist or a cancer doctor. You can simply go to a physician,
Physicians.
whom you can confide, whom you can talk, जिनसे आप दिल खोल के बात कर सकते हो, जो आपको देखे. अगर उनको कुछ suspicion लगे, then he can always refer to us.
Now coming to the, now that we are talking about diagnosis.
About the diagnosis, that's what I say. So if you are suspecting cancer, so we have some investigations which we do. We generally do a local physical examination, a thorough examination, looking at the ulcer or the lump, how it is, whether it is painful or painless, whether it is fixed to the nearby skin or organ, whether there are other lymph nodes on the other sides. Then we do imaging. The common imaging in head neck cancers are either a contrast enhanced CT scan or preferably a contrast enhanced MRI scan. MRI gives a better resolution for the soft tissue. We also do sometimes a CT scan of the thorax, that is chest, to look if the disease has spread there.
Okay.
Generally, PET scan is not mandatory, but sometimes we do to see any distal metastasis is there or not. That is, the disease has spread out of local area. But a physical examination, a biopsy, which is taking a piece of
Biopsy,
mass
taking a piece,
under direct guidance or an ultrasound guided biopsy, a CT scan or an MRI is the general, and of course a few blood tests to see if the patient is fit enough.
So these are the different ways of diagnosing.
Investigating, yeah.
Now, talking about technology, cancer has, this issue has been prevailing since so many years. If we talk about head and neck, tracing the cancer, technology plays a very important role. What do you think? Has it improved compared to past few decades, and has it become easier now to diagnose it?
Well, as far as जैसे आपको बताऊंगा, जैसे from imaging, the MRI has really improved. We now have a PET MR, which is a composition of PET scan and MRI scan, which gives even better results sometimes. We also have PET CT scan. We have different imaging modality like infrared imaging to look for early changes in the mucosa.
Okay.
We also have got these circulating tumor cells, which we sometimes look for it to find out if there is any residual disease. We have now different image guided biopsies, which can do a biopsy from difficult places like a CT guided biopsy or MRI guided biopsy or the ultrasound guided biopsies. And of course, we have different pathological diagnosis. We also have telemedicine and digital pathology, where we can export the images to a referral center so that we get a better diagnosis, because once you see them under microscope, you may not always have a expert pathologist. So nowadays, with digital radiology and digital pathology, you can take the scan and you can do the biopsy and make the slides and send the image to a distal place where a more expert pathologist and radiologist are seeing, so we get the results. So technology is helping us. Technology is also helping us. AI guided image sorting. So if you are screening a lot of images, a human may fail, but AI guided image sorting might pick up early changes. Yes. Then of course you need a human guy to finalize that.
Yes, but it does reduce manpower.
It does reduce manpower. It sometimes for a screening tool it really helps. So AI is helping us. Yes.
That's great. And now talking about surgery, if the cancer is on a very initial level, and has the surgery requirement reduced? If we talk about medicines and injections,
you see, surgery still remain one of the cornerstone in treating head neck cancer, especially in the oral cavity and buccal mucosa. But obviously, when we talk about surgery, we nowadays try to minimize the extent of surgery, of course, with keeping the oncological parameter intact. So we are talking something called R0 resection, that we need to take out all the macroscopic as well as microscopic disease. But we also take help of a multidisciplinary team. Like we take help of a reconstructive surgeon to reconstruct that area, or a plastic surgeon, what common people understand. We also, post-surgery, we take up the help of a speech and a swallowing expert to get back the person immediately on the path of, because these sort of surgeries sometimes affect the swallowing and the speech.
Yes.
So we try to take the help of this expert to recuperate him quickly. Nowadays, we also try to give him as a treatment first, medical treatment to shrink the tumor, so that extent of surgery gets reduced. So that is called neoadjuvant or induction chemotherapy along with immunotherapy. So medical treatment also has got some newer things. From conventional chemotherapy, we have got now targeted therapy, and we also have now got immune checkpoint inhibitors or immunotherapy. Mostly they are used in advanced disease, but in an relatively early disease where we are trying to shrink the tumor, we can take help of this chemotherapy and as well as immunotherapy and targeted therapy.
And now talking about the growing concern of HPV-related head and neck cancer. So does it contribute a lot when we talk
Well,
about
we do see a percentage of them. They are mostly younger.
Okay.
And they are in fact a better prognosis. HPV-related cancers, they are easier to treat, and they have a better response to treatment. So so we always look for HPV, especially the younger patient. When we look for HPV positivity, human papillomavirus positivity, and and as you know, in girls we are giving vaccines for HPV for cervical cancer. Actually,
Yes.
boys can also take this vaccine because
Okay.
there are suspicions of anal warts or other things. So HPV vaccination should not be confined to only girls, I believe.
Okay, so this is yet another update that boys can also go for
I
it.
mean, you see, the HPV is a sexually transmitted, but then there can be not only the cervical cancer is only for a part, but there can be other things like anal warts and other cancers which can also be targeted. So
Okay.
it can be gender neutral sometimes.
Okay, and other than that now coming on the psychological impact of course, when patients come to you, they are a victim of cancer and then they get treated. You witness the whole journey. So, how important it is for doctors and the family to keep them motivated?
Oh, it's absolutely essential.
How has your experience been? Let's just say that if there are 100 patients.
This is very important. In fact, I would like to say this is my personal experience. The same people, same stage, a person who is more positive and has a good family support always does better than a person who is a loner, who doesn't have a family support, who has negative
and
mind.
maybe a negative mindset.
Yes. So mindset is a very, very important thing. But mindset also comes from family. So family support is very, very important. So that gives you the hope. And without hope, there is nothing.
Yes.
Now, as you know, head neck cancer affects a small area with a complex anatomy. So there is even that post-treatment, there are a lot of issues. Like post-radiation, there is a dryness of mouth. There is a swallowing difficulties. There is difficulty in opening the mouth. There is a speech problem. So it can happen a person's self-image, self-esteem, day-to-day activity. There are marital problems, psychosocial problem. So for that, to overcome that, people need counseling. People need help of experts like speech and swallowing experts, as well as like post-radiation, when you have a dryness of mouth, we sometimes ask them to change the way they eat, carry them a small water bottle and take sips of water every now and then. And sometimes we also give in extreme cases artificial saliva to help them to swallow food. But these all can be overcome, and the side effects can be minimized for a patients of laryngeal cancer who had to undergo complete laryngectomy or voice box, so we have a artificial voice box. We have various ways to improve their swallowing speech. So people should not lose hope, and they should also discuss it frankly and openly with their doctors.
Yes.
And the physicians also need to engage with the patient,
Yes.
and take the help of other experts of field like speech and swallowing expert, as I say, physiotherapist, and a constant mental support. A doctor is someone who is not only just write prescription, is also hands-hold you in the difficult period. So the patient trusts you, confides in you, and you should also reciprocate on that.
Do you also recommend patients therapy sometimes?
Yes,
Because
if
of
they
the
fail,
psychological
yes,
effect that they are-
counseling is a important part, and if we find that patient is not
Yes.
improving with it, because most of medical oncologists are also busy, and
Yes.
sometimes we lose focus. We
Yes.
focus too much on the treatment, and sometimes.
Plus you have many patients.
So
You are very
I think
occupied.
having we have in Apollo, as you know, we have
Yes,
a counselor.
yes. Oh,
And
okay.
Yes, we do have counselors, and we sometimes do send them to my psychiatrist colleague, so that not for but for counseling. They have a better setup for counseling. But we have in oncology department also, we have counselors.
Okay.
So counseling is a part of it. So
Yes. So along with physical treatment, when you are getting cured, if you still don't feel good or motivated enough, I think psychological impact is very important. And for that, to cure that, to overcome that, counseling and seeking help of psychologist or psychiatrist is also considered an important
So
part.
most important thing is to talk. So I always tell my patients that when in doubt, speak out. I tell them frankly that before you leave my office, my chamber, you should have your questions answered. And if you forget something, next time please write them down on a piece of paper and bring it to me.
Okay.
So one thing is that you need to remove that barrier. So
Barrier.
sometimes, table makes a barrier. So I used to be taught in our MBBS that when you speak with your patient, it's better that like you and me are sitting without a table
A
in between.
barrier.
So that creates. So listening to the patient's complaint is something. So the art of listening is a very important art. Unfortunately, most of us are becoming busier day by day. So, but still, I think listening is an important issue. Because most of the patients are afraid. They don't, in fact, if I can just say, they don't come to me because I speak better English or I am a more well-dressed. No, that's not for they. They're coming to me for some help.
Language barrier is also one of the problems.
Language
I think
barrier is
this
definitely an important
This is
issue.
something you must be clarifying them that ठीक है आपको जिस भी भाषा में
हाँ.
बात करनी है आप करो मैं कैसे रिप्लाई कर रहा हूँ that is one thing but आप किस में comfortable
No. So you see, most of my patients are Hindi speaking.
Hindi speaking.
I don't speak Hindi very well, if you can see. I'm not from this part.
Ji.
But when you talk, people understand that whether you are sincere or not. So again, your Hindi grammar doesn't make a difference. How you speak,
Yes.
and the body language. When you handhold them, talk to them, you reassure them, they understand. So yes, if you can communicate, because I do see patients from other part of the world. So English-speaking patients are easier. French-speaking patients, sometimes we need help of translators. And that because, but still, ultimately, there is an universal language of love, compassion that helps. So you need to be sincere. That's it. You need not to be a very smart in the sense. You need to be, of course, well-read, well-versed in a subject. But you need to be compassionate. You need to have empathy. That's more important for us.
Definitely. And now talking about another important topic, which is, you have already mentioned it multiple times here, but let's just focus on it once because I also want to know more about it. How badly does these cancer illnesses affect the swallowing, the speech, and the rest of the breathing part, and when it has affected badly, while they are recovering and they get cured, does it improve drastically or it improve mild? I mean, we just need an idea.
So you must
all in all.
understand, Soumya, that we don't understand, but our swallowing is a very complex physiological procedure. when we chew, food becomes a bolus or a ball-like thing. Then the tongue, basically the tongue is one of the most muscular organ in our body. It is the most muscular organ in our body. Per square inch area, it has got more muscle than all your bicep, triceps, quadriceps. Yes.
Okay.
So it pushes the food around so that it gets chewed and crushed by your teeth. Then it moves them to make a ball, which is called bolus.
Okay.
Then the tongue pushes this ball towards the posterior part of the tongue, and then the esophagus opens up like a snake opens his mouth to take the ball. Now, when the ball is coming, in front of esophagus, there is our respiratory tube, the trachea and the larynx. So, larynx, there is a lead called epiglottis. So, the epiglottis closes, the food bolus rolls over the epiglottis comes to the esophagus or our food pipe, which is behind the respiratory pipe, and then respiratory food pipe opens up and swallow it, and then like a snake it pushes the food bolus down by a process called peristalsis. So it's a very complex physiological
That's
procedure.
Intense and complex.
Yes, and that's why हमारे बुजुर्ग जो बोलते हैं ना, खाने के समय बात मत करो. The reason being that when you talk, आपके respiratory pipe खुला रहता है, so epiglottis खुला रहता है, because you need that air to vibrate.
Yes.
And उस समय आप खा रहे हो तो खाना पीछे जा रहा है, तो कभी-कभी inadvertently वो खाना सांस की नली में जा सकता है.
There are many cases
Yes,
like that as well.
so that's why. So once you get surgery, undergo surgery in this area, give radiation, fibrosis. So ये जो swallowing process है ना, ये बड़ा affect होता है. So we do get people do get micro aspirated. थोड़ा थोड़ा करके aspiration हो जाता है, क्योंकि वो ठीक से epiglottis close नहीं हो पाता, खाना ठीक से move नहीं कर पाता, esophagus खोल नहीं पाता, that whole area gets affected. So to overcome this process, we need intense swallowing and speech physiotherapy. Sometimes in extreme cases हम ये सांस की नली में एक छोटा सा छेद करके हम एक ट्यूब डाल देते हैं, ट्रैकियोस्टोमी ट्यूब टू प्रोटेक्ट. समटाइम्स हमें खाने का रास्ता भी चेंज करना पड़ता है. समटाइम्स इनिशियली इमीडिएटली आफ्टर सर्जरी हम लोग नाक से एक फूड पाइप डाल देते हैं, जिसको राइल्स ट्यूब बोलते हैं, फॉर द टाइम बीइंग. एंड दिस रिकवरी मे टेक सम टाइम, समटाइम्स इन वीक्स. सो वी नीड टू कॉन्स्टेंटली engage with the patient to explain them that it may take time. And post surgery, post radiation, there are certain changes, the way you eat, the way you drink, what you can eat, how frequently you need to be conscious.
I'm sure the way you eat and what you eat would be a very important topic.
Yes, sometimes liquid has a more tendency to get aspirated. So when you drinking, you ask them to sit, move, and then take. And if there is any post drinking severe cough, we sometimes look for it. So and that constant physiotherapy. Sometimes post surgery we have problem in opening the mouth because of the fibrosis. So there are ways to gradually increase that mouth opening. But that all requires a post treatment few months to continue. So people think that once the surgery is done or treatment is done, it's over. No. The actual rehabilitation process starts then, and it may take weeks to months. And you need to engage with this to get the best result.
So, if I'm not wrong, when the surgery is done, when the treatment is done, you need to understand your neck and mouth area. You need to understand what the problems were and how you have to overcome that, and you have to start practicing along with the guidance of your.
Yes, there's a professional help. You need a professional help for that. Yes.
And then you need to practice it, and that's how you cope up and
absolutely
take it forward.
Absolutely.
Okay, so this is another journey that they have to go to.
Yes.
And so eating is very important. Breathing is, of course, it's a part of it. Speech. If we talk about speech.
So there is speech also gets affected, especially.
Yes. Are there patients who have? Because you just said that communication is the most important medium.
And a patient's self-image gets distorted. So suppose the patient has a cancer of the tongue. So half of his tongue is operated out. So he's talking, obviously it gets affected. If you have a cancer in the voice box, then if surgery is done, voice box is gone. So sometimes they have to relearn how to speak. Sometimes you have to put machines to use that. But those can be overcome. Things can be improved, provided people are engaged effectively and they practice regularly.
Okay.
So as a doctors, our goal is to explain to the patients that these changes can happen, how to overcome this, and how to make the best out of it, and give him the directions and engage with the different professionals who can help them to get the best.
एंड आई थिंक हमारी जितनी ऑडियंस है उनको भी समझ आया होगा कि कितना कॉम्प्लेक्स है और कितनी समझदारी के साथ इसको टेक फॉरवर्ड करना होता है एंड फैमिली सपोर्ट कितना चाहिए होता है. इसके अलावा अब जो एक और इम्पॉर्टेंट बात है जो मैं करना चाहती हूँ वो ये है कैंसर ट्रीटमेंट. एवरीथिंग इज़ डन एंड नाउ टॉकिंग अबाउट द साइड इफ़ेक्ट्स ऑफ द मेडिसिन्स और द होल प्रोसीजर. सो क्या होते हैं, आप लोग बताते हैं पेशेंट्स को कि हाँ भाई ये साइड इफ़ेक्ट्स आप नोटिस कर सकते हैं या
So as I've told you, the surgery, it requires part of your oral cavity or oropharynx or areas of the head neck to be removed. So obviously भगवान का दिया हुआ चीज़ अगर आप हटा लेते हो उसमें जब आप जोड़ तोड़ते हो कुछ तो डिफरेंस होता ही है. So that gets affected. जैसे बोला आपके जीभ की अगर half you have removed, then your speech, your swallowing, that's get affected. Once you give radiation, post radiation आपके जितने salivary glands हैं वो affect कर जाते हैं. So उसमें आपके मुंह सूख जाते हैं. कभी कभी तो हमारे पास ये चैलेंज आता है कि एक बार रेडिएशन हो गया तो अगर दोबारा रेडिएशन देना है तो कैसे दें, क्योंकि एक टिश्यू की एक रेडिएशन लिमिट होता है. तो बहुत जल्दी आप एक बार रेडिएशन देने के 1-1.5 साल के अंदर दोबारा रेडिएशन उस एरिया में नहीं दे सकते हो. आजकल खैर देयर आर न्यूअर मेथड्स ऑफ रेडिएशन लाइक प्रोटॉन थेरेपी वेयर यू कैन रेडिएट दैट एरिया विदाउट डैमेजिंग द अदर, बट दैट्स एक्सपेंसिव. बट वी हैव बट प्लस जब आप केमोथेरेपी देते हो, केमोथेरेपी के बाद ऑल्दो इट इज़ मोस्टली टेम्पोररी बट इट कैन कॉज ओरल अल्सर्स, it can cause nausea, vomiting, decrease in food habit. Some of the drugs like cisplatin can also affect your kidneys. So you have to actually look, not all treatment fits everyone.
Yes.
So then you have to look at the person, his age, other comorbidities like diabetes, hypertension, heart disease to decide what treatments acts better. We have now targeted therapy and immunotherapies, but they are also not exactly without side effects. They may have a less side effect, but sometimes they can also. So as an oncologist, there is, when you see a patient, there is no one size fit all. You have to see the patient as a whole. You have to see the person's, his background, his educational qualification, understanding, family support, how far he resides, whether he will be able to come more frequently, whether post treatment वो regular follow up के लिए आएगा, whether he understands the implications. द ट्रीटमेंट की जो दौरान जो डिफ़िकल्टीज होगा वो बिना बीच में छोड़ के चला तो नहीं जाएगा. सो दैट्स हाउ व्हेन यू सी अ पेशेंट यू हैव टू सी एवरीथिंग, यू हैव टू एक्सप्लेन हिम, यू हैव टू एक्सप्लेन द फैमिली, you have to carry him along through the journey, because honestly this is not an easy journey. Sometimes the road is bumpy. So as an oncologist you are most of his, not only his physician, it was his friend, philosopher and guide for the time being, so that उसको आप सही रास्ता दिखाओ.
And what are the chances of reoccurrence? The patients have recovered, cured. Do you get an idea that, okay, in this case it might reoccur and we need to tell our patient that you have to be very
So there
careful.
are two things. There is relapse or there is second malignancy. As I told you, this tobacco affect the whole mucosa. There is something called field cancerization theory. So जैसे आपके ये डैमेज होता है, एक जगह पे कैंसर हुआ है, दूसरे जगह जो डैमेज एरिया था, जो प्री कैंसरस था, 10 साल में हो सकता है वहाँ दूसरा कैंसर हो.
Okay.
So ये
is that called relapse?
Relapse is something where the same area में कैंसर होता है या तो वैसी कैंसर होता है, और इट कैन बी अ सेकेंड कैंसर ऑल्सो. हेड नेक कैंसर में दोनों संभव है. सो देर आर सम कैंसर्स जिसमें कैंसर्स ज़्यादा जल्दी आने की, जैसे टांग का, जीभ का जो कैंसर है, इट इज़ वेरी नोटोरियस फॉर अ रीऑकरेंस बिकॉज इट्स अ वेरी वास्कुलर ऑर्गन, यानी कि इसमें ब्लड वेसल्स बहुत सारे रहते हैं, तो कैंसर सेल्स इधर से उधर और चले जाते हैं, तो ये जल्दी आते हैं. सो देयर आर चांसेस ऑफ रीऑकरेंसेस, नो डाउट अबाउट दैट, and that is why we always keep the patients on a regular follow-up. For the first 1 or 2 year, almost every 3 monthly we see them फिजिकल एग्जामिनेशन करते हैं, लोकल एरिया देखते हैं, एंड 3 से 6 महीने में हम इमेजिंग भी करते हैं, लाइक CT स्कैन ऑफ द हेड नेक एरिया. आफ्टर दैट वंस इन 6 months एंड लेटर वंस ए ईयर हम एनुअल चेकअप करते रहते हैं पेशेंट को फॉर अ लॉन्ग टाइम, 5 to 10 years.
Okay, perfect. So we have covered a lot of topics now, but if I have to ask you in pointers, things to prevent head neck cancer, what would you like to mention to the
Don't smoke.
audience?
Don't chew tobacco. Don't chew betel nuts, सुपारी, तंबाकू, पान मसाला. कोई भी फिल्म स्टार, कोई भी है जो बोले पान मसाला, गुटखा, खैनी, तंबाकू सेहत के लिए हानिकारक है. There is absolutely nothing good about them. There is absolutely no smartness in smoking. Many people who showed smartness died of lung cancer. Be actual smart. Avoid getting trapped into tobacco. Don't drink. There is also nothing smartness about drinking also.
Yes.
At least try to cut down if you are doing it. Smoking and alcohol are the 2 important preventable thing to avoid head neck cancer. It's a painful way to die. If it were detected early, we can cure most of the cancer. So if you are having suspicion that आपको कैंसर हो सकता है, आपके मुंह में कोई अल्सर्स हो जो ठीक नहीं हो रहा है, आपके गले में आवाज़ में कोई चेंजेस है जो ठीक नहीं हो रहा है, आपके कहीं गले में कहीं गांठ है जो इम्प्रूव नहीं हो रहा है, मुंह के अंदर कोई वाइट पैच है या रेड पैच है जो कि इम्प्रूव नहीं हो रहा है, प्लीज़ गो एंड शो टू ए डॉक्टर. It can be a local physician, it can be an ENT guy, it can be a dentist, but for God's sake, show him. In 90% cases, it will be nothing. कुछ नहीं होगा, benign disease. You got your peace of mind. और वो 10% में अगर वो कैंसर निकलता है, अर्ली कैंसर, ट्रीटमेंट हो सकता है, ट्रीटमेंट से आप ठीक हो सकते हैं, जो ट्रीटमेंट आपके नियरेस्ट सरकारी अस्पताल में भी उपलब्ध हो सकता है. तो प्रॉब्लम से भागने से प्रॉब्लम सॉल्यूशन नहीं होता, उसके लिए आपको काम करना पड़ेगा, और उसमें काम क्या है, आपको डॉक्टर को दिखाना चाहिए. सो दिस इज़ माई सिंसियर रिक्वेस्ट टू ऑल ऑफ यू.
That was a very perfect, I must say, Dr. Panda, message to the audience, and I hope everyone follows it. But I have one more question, which is the future of head neck cancer. What do you see with the help of technology and with the help of medicinal advancements compared to other cancers? What do you think? Where does it stand?
Well, I must say the future looks promising. We are galloping in the way of diagnosis. So there are imagings, as I said, from CT, MRI. We have now got AI-guided image sorters. We have got integrated PET MR. We have got this infrared lighting to early diagnosis of mucosal damages. In the treatment, we are now getting into the minimal access or transoral robotic surgery.
Okay.
The TORS to decrease, especially in the recurrent disease, to decrease the extent of surgery. TORS is not for everyone, so your doctor needs to decide whether open surgery versus a robotic surgery can be good. So robotic surgery for robotic surgery is something. So just don't jump because it's more fashionable. But it is available in select cases, it can help. We also have radiation therapy. You have proton therapy, which can give a high dose radiation in a limited area with a precision, which can reduce the damage to other places of. As such, proton therapy is indicated in pediatric cancer, cancers in critical area, and re-irradiation, but in head neck cancer, its use is growing day by day. There is a cost factor, but it's an effective treatment. There is also, we know that immune checkpoint inhibitor or immunotherapy has come in a big way in head neck cancer. Now we are trying to integrate immunotherapy with chemotherapy, immunotherapy with radiation therapy. Last but not the least, there is something called CAR T cell therapy, which is also being tried. Okay. Which is your own body's immune system they are primed to fight with cancers. CAR T cell therapy has already been in treatment for blood cancers, lymphomas and leukemias, and it is also coming in head neck cancers. There is also treatments for like gene editing. They are mostly for the cancers which are hereditary or disease like CRISPR. You may have heard of it, which is mostly approved for sickle cell anemia and thalassemia, which are non-malignant hematological disease. But I'm sure coming ahead, gene editing therapy will change many hereditary cancer as well. So yes, as far as diagnosis, the screening, like I have told, telemedicine, teleradiology, digital pathology has helped in the remote part of our country can be access to a more central area where there are more doctors or more experts available, so that expertise can be managed. And we are not far away when even remote surgery is also possible. There are already heart surgeries being done on remote consoles with robots, and a day will come when even head neck surgery can also be accessed. So yes, the future look promising, and we in India are actually thick in the middle of it, and we are lucky that most of the treatment are available here at a fraction of cost to the Western world.
Wow. Indeed, it looks promising because you mentioned so many of the aspects and so many variety of technology which can be used now. And I think the important thing about this podcast is how we have covered all the topics covering the head neck cancer prevention, causes, and what are the things that needs to be taken care of, the environmental factors, most importantly, how we can improve our atmosphere and take care of ourselves, and saving ourselves from head neck cancer, and most importantly, the doctors who are working so hard to make sure that all of us are healthy. Even when cancer arrives, we do get ill of it, and then the doctors help us live happily, psychologically healthy. So that, thank you so much, Dr. Panda, for your time and for simplifying everything for all the people who are viewing it. And we hope we get your support like this, and we once again talk about another important and crucial topic. Thank you very much.
Thank you so much. It was a pleasure talking to you.
Thank you so much, everyone. We hope all of you understand head neck cancer in a better way, and I'll see you next time. Your host, Soumya Mishra. Thank you.